The following is an article from Health Magazine, our special sleep edition from summer 2023, published by the Southwest Utah Public Health Foundation. DIY Cbt-I, The Promise of Cognitive Behavioral Therapy for Insomnia, by David Heaton, LCSW, Health Magazine editor. Cognitive behavioral therapy for insomnia, or Cbt-I, is now recognized as the most effective non-drug treatment for people with insomnia and is often more effective than medications in the long term. Cbt-I has an average treatment effect of at least 50% improvement that tends to last and even improve over time. What is CBT? Cognitive behavioral therapy is a model of psychological treatment originating in the mid-20th century that explores how cognition, your thoughts, emotions, your feelings, and behavior, your actions, are linked. An underlying principle is that you can use reasoning to choose how you perceive and react to the events and challenges of life. Instead of being a victim of your own irrational beliefs, you can become empowered with the realization that you can control your emotions, thoughts, and actions. This can be challenging, so many people seek help from therapists to guide them through CBT techniques for specific problems. CBT is the most researched form of psychotherapy and was the first model tested with strict evidence-based criteria typically used in the health field. The American Psychological Association states that CBT is an approach for which there is ample scientific evidence that the methods that have been developed actually produce change. CBT effectively treats depression, anxiety, PTSD, phobias, OCD, eating disorders, addictions, and relationship problems, even chronic pain and tinnitus, among other problems. What is Cbt-I? Cbt-I is a cognitive behavioral model specifically designed to treat insomnia, pioneered over 30 years ago by clinical psychologist Arthur J. Spielman. He insisted that insomnia was not just a symptom of other mental and physical health disorders, but could be its own condition requiring specialized attention. A tribute published in the Journal of Clinical Sleep Medicine after Dr. Spielman's death in 2015 stated that his main legacy is that he fundamentally changed the way clinicians think about insomnia and then followed up by changing the way they treat it. Cbt-I uses several different approaches in treatment, including assessment, education, thought restructuring, behavioral training, and motivational techniques. It is a brief treatment that is typically provided to individuals or groups in 6 to 8 sessions, although it has effectively been done in 2 to 3 sessions, depending on client needs. How do I find a Cbt-I provider? There are currently some challenges to accessing Cbt-I, the first being a shortage of practitioners. Physicians rarely have the capacity to provide it or may be unaware of Cbt-I, relying instead on medications as a first-line treatment for insomnia patients. The Cbt-I model is best suited for psychologists and mental health therapists as providers, although the Center for Deployment Psychology observes that many clinicians are experienced with some of the components of Cbt-I, but very few have been found to routinely use the full evidence-based complement of assessments, interventions, and outcome measures in a systemic manner. Another limitation is health insurance, which would usually cover Cbt-I for insomnia only if caused by diagnosed depression or anxiety. Out-of-pocket costs for therapy, including Cbt-I, would run at least $100 per session, which may discourage some people. What are some solutions? Once physicians become aware of the value of Cbt-I, they would need community providers to refer insomnia patients to. Otherwise, online or self-help resources are the only options. Awareness of the model and increasing demand for Cbt-I services may motivate local therapists to get trained. Many clients with depression, anxiety, and PTSD disorders have some form of insomnia. Trained therapists could provide Cbt-I treatment to their insured clients who have those diagnoses. In the meantime, some therapists offer other models to treat insomnia which can still be helpful. Group therapy can usually be offered at a lower rate than individual treatment, so Cbt-I groups could provide a more affordable option for the uninsured. Advancements in technology have made Cbt-I therapy available virtually and digitally, enabling people with insomnia to get help where there are no local in-person resources. Self-help. Working with a trained professional can help insomnia sufferers with motivation and setbacks, especially if there are also issues with trauma or clinical depression. However, for those of you who are ready to apply Cbt-I principles on your own, There are now books, online courses, and apps that can help you learn and apply them. For starters, here are some of those techniques. Psychoeducation. Knowing is half the battle. Learning about how sleep works and why it's important can help motivate you to make changes in your bedtime habits. Hopefully, the articles in this magazine can help with that. Becoming familiar with good sleep hygiene, see page 12, is also a core component of Cbt-I. Get a baseline. Start a sleep log to track your sleep efficiency. This is how long you're actually asleep in bed, which should be at least 85%. You calculate sleep efficiency by taking the total time in bed in minutes and subtracting the time it took to fall asleep along with any time awake during the night. Divide that number by the total time in bed, then multiply by 100. Example, you went to bed at 11 p.m. last night and got up at 6:30 a.m. this morning. That's 7.5 hours, or 450 minutes. You think it took about half an hour to fall asleep, and you remember waking up twice during the night and being awake for about 10 minutes each time. That's 50 minutes. 450 minus 50 equals 400 minutes of actual sleep. Dividing 400 by 450 equals 0.89, multiplying by 100 to get 89%, which is in the healthy range. Track your sleep efficiency for 2 weeks. Some smartwatches and fitness trackers can do this for you. Figure the average to use as a baseline going forward. Continue monitoring your sleep quality as you try Cbt-I techniques, noting what is helping or not. You can discontinue tracking once your sleep has improved to your satisfaction. Cognitive restructuring. People with insomnia often develop inaccurate thoughts and beliefs about sleep that lead to behaviors that make sleep worse, which further reinforces the negative thoughts. For instance, someone with insomnia is worried about falling asleep, so tries to go to bed too early and spends hours in bed experiencing increasing panic about not being able to fall asleep, which in turn actually makes it harder to sleep. Cognitive restructuring attempts to disrupt this harmful cycle by examining, challenging, and changing the irrational thoughts and beliefs. Here are some examples of restructuring thoughts. Irrational thought, I haven't slept for days. Reality, I may have had poor sleep recently, but I've actually slept for at least a few hours every night of my life. New thought, my body makes sure I always get some sleep. I'm looking forward to improving my sleep hygiene to make it even better. Irrational thought, I can't sleep. I'm going to be a wreck tomorrow, versus I'll just get up and read until I get tired. I'll be fine in the morning. I'll probably sleep better tomorrow night. Stimulus control. If your bed becomes associated with anti-sleep behaviors like eating, working, studying, or watching screens, it may switch from a restful stimulus to a stressful one. Repair this by using the bed only for sleep and related activities. Leave the bed and do something non-stimulating if you're struggling to fall asleep for more than 10 minutes, then go back to bed when you're tired. Set an alarm for the same time every morning, and avoid taking daytime naps. Sleep restriction. This technique builds on stimulus control, dissociating bedtime from negative experiences while building sleep pressure to stabilize sleep cycles. Using a sleep log to get an average of how much time you're actually sleeping each night, you were then only allowed to be in bed for that many hours while keeping the same waking time. If you're usually in bed for 8 hours but tend to lay awake for around 2 of those hours, you're only sleeping 6 hours. So you would start by going to bed at 1 a.m. if you have to get up by 7 a.m. A word of caution, you will likely not sleep through the whole 6-hour period at first, in this example, and naps are not allowed, so you will be dealing with the effects of sleep deprivation for a week or two. You should use caution when driving or operating heavy machinery if you're feeling sleepy during the day. This technique is also not recommended for people with certain medical conditions like seizures or bipolar disorder. When you're sleeping most of the 6 hours, you would add another 15 to 30 minutes and go to bed a little earlier every week or so, continuing the process until you are sleeping better through the night and feeling rested during the day. Relaxation training. These techniques can enhance your natural relaxation response while decreasing the anxiety and racing thoughts that often come with being unable to sleep. They can become part of your bedtime routine when you lie down at night. Breathing exercise involves taking slow, deep breaths, which have a calming effect on your heart rate, anxiety, and stress. A suggested pattern is to inhale through the nose for 4 seconds, hold for 7, then exhale through the mouth for 8 seconds. Repeat 6 times. Progressive muscle relaxation is the process of tensing and relaxing your muscle groups, moving from the toes to the head, or vice versa, as you lie comfortably in bed. Guided imagery is the practice of envisioning an actual or imaginary calming scene, then taking time to become aware of the sights, sounds, and sensations you might experience there. Some people combine visualization with breathing and muscle relaxation. Music or a recorded voice narrator can be used as well. Biofeedback uses technology to monitor brain waves, heart rate, breathing, and temperature. When connected to these devices, you can use relaxation techniques to watch your body's stress readings decrease in real time, reinforcing your ability to control your reactions to stress. Office visits for biofeedback or home use devices can be pricey, but you can use an inexpensive pulse oximeter on your finger to watch your heart rate decrease as you try relaxation exercises. Meditation. Learning to focus attention through meditation has shown to reduce stress and anxiety while increasing relaxation. Practicing forms of meditation during the day that involve movement, like yoga or Tai Chi, promotes mindfulness skills that will help your approach to sleep as well. Things to consider. Don't get discouraged if Cbt-I doesn't work right away. It can take time to learn and practice new skills. You might experience some sleep deprivation at first when implementing stimulus control and sleep restriction, but this should soon resolve as your body adjusts to a more consistent schedule. Some people find it helpful to track their progress over time in order to see small improvements that can encourage them to continue treatment. The success of self-initiated Cbt-I techniques will largely depend on your ability to make them a daily priority. Sleep logs, sleep hygiene, and reprocessing automatic thoughts need daily attention to be the most helpful. Medications. Jeffrey Rossman, Ph.D., notes that although sleep medication can be an effective short-term treatment for insomnia, some patients experience side effects such as amnestic episodes, cognitive impairment, and morning hangover. He continues, whereas sleeping pills mask the symptoms of insomnia, Cbt-I promotes a genuine learning process that restores the body's natural sleep mechanism. Still, patients who are taking sleep medications should consult their doctor before weaning off or discontinuing them. Other uses. Cbt-I shows potential for working with short-term insomnia and people who are struggling with insomnia due to pregnancy, PTSD, and cancer recovery. DIY Cbt-I resources. The Department of Veterans Affairs offers their own app called Cbt-I Coach that is appropriate for non-veterans and veterans alike. Cbt-I Coach is a free self-help mobile app to guide you through developing and maintaining good sleep habits. The VA also has a web-based Cbt-I program that can be used on devices or computers called Sleep Easy, found at veterantraining.va.gov/insomnia. There are a variety of Cbt-I-based online programs available for purchase, from the Cleveland Clinic's 6-week Go to Sleep program, $40 at clevelandclinicwellness.com, and the Conquering Insomnia program by Dr. Greg Jacobs, $50 at cbt4insomnia.com, to more expensive options costing several $100s. While they can be used on their own, these resources are not intended to replace therapy. If listening to this article put you to sleep, you're welcome.